Good morning, good afternoon, good evening. I would like to start thanking the organizers for inviting me to speak at this conference. I'm really happy to be back. I have no conflict of interest to declare. I will talk about the Access to COVID-19 Tools Accelerator, the COVAX facility, the vaccine rollout situation, raise some challenges and make some conclusions at the end. So the global situation as of 8 of June this year showed that we had about 180 million confirmed cases of COVID-19 since the beginning of the pandemic, with nearly 4 million deaths globally. Here you see the distribution of the daily cases reported by region, the region of the Americas in yellow, here in green, the European region, and the big violet curve is Southeast Asia, in fact. What we see is that in nearly all the regions, the number of daily cases has been decreasing, and same for the globally reported daily deaths. What we see here on the right side is the countries with the highest number of new cases in the previous 24 hours. And 3 countries in Asia are among the top 10 countries. These are India, and is ranked as number 1, and then followed Indonesia and the Philippines. But also Malaysia is dipping in and out depending on the number of cases reported. So let's come to the ACT Accelerator. The ACT Accelerator is a groundbreaking global collaboration to accelerate the development, production, and fair and equitable access to COVID-19 vaccines, therapeutics, and diagnostics. It was launched in 2020 by WHO, the European Commission, and France in response to this pandemic. It brings together governments, global health organizations, manufacturers, scientists, private sector, civil society, and philanthropy. The COVAX pillar is here on the left. It's focusing on vaccines. It's co-led by CEPI, that's a Coalition for Epidemic Preparedness Innovations, Gavi, the Vaccine Alliance, WHO, and UNICEF. The basis for ACT Accelerator is the health systems strengthening all across the 3 pillars. The ACT Accelerator aims to deliver 2 billion vaccine doses by the end of 2021, 245 million treatment courses by mid-2021, and 500 million COVID-19 tests by mid-2021 to reduce COVID-19 mortality and severe disease. So why do we need COVAX? Vaccine inequity in times of global pandemics are a tragedy for everyone. And we want at any cost avoid that. Bilateral deals will leave inevitably lower and middle income countries behind. So also vaccines need to be developed in a short time during emergencies. Usually such research and development would take decades. There's a high risk of failure for developers. Only about 10% of vaccine candidates make it from the initial phases of clinical research to the market. On request of member states and building on the experience of PAHO, the revolving fund, it is a mechanism to pool actually large volumes of procurement and also pool risk sharing. We have shown that with the commitment of member states and partners to work together in the interest of a global public good, we have now several vaccines available. So what are the goals? Countries participating in COVAX can access the largest portfolio of COVID-19 vaccine candidates in the world. The approach of backing a diverse range of vaccine candidates increases the chances of developing multiple successful vaccines, which is critical if the world is to meet the high demand. So COVAX works by pooling financial resources to develop vaccines. purchase them at scale, and investing upfront in manufacturing so that vaccines are ready to be distributed as soon as they are licensed. So COVAX offers a compelling return on investment and guarantees fair and equitable access to COVID-19 vaccines for all participating countries. So we have two tracks of countries, those who receive donations and those who are self-financing. There's countries which are receiving donations, we also call them AMC countries or advanced market commitment countries, are those receiving donations under the 92 World Bank designated low and middle income countries or economies, which have less than $4,000 per year of GNI. And the second track is for self-financing countries. COVAX has also developed a platform with SWAT teams. SWAT teams, this is actually, SWAT stands for Support Work to Advance Teams. So there are 3 SWAT teams: the Enabling Sciences SWAT team, the Clinical Development SWAT team, and the Manufacturing SWAT team. And these 3 SWAT teams work under the guidance of the Regulatory Advisory Group. So what do they do? The Enabling Sciences SWAT teams provides cross-cutting support to COVID-19 vaccine developers in the area of standards, assays, and animal models, for example. The Clinical Development Operations SWAT team collaborates on initiatives related to clinical operations and trials. So, for example, to look together at trial site readiness criteria, setting up clinical trials site networks. They also look at vaccine safety, look at vaccine science and other aspects. The Manufacturing SWAT teams focuses on cross-cutting support for COVID-19 vaccine developers in the areas of drug substance and drug product scale-up and scale-out, supply chain and release assays. The regulatory group consists of members from regulatory agencies from around the world. And from Asia, we have 2 countries participating. These are Japan and Singapore. As of 10th of June, we had 287 vaccine candidates for COVID-19 in the pipeline. And out of those, 102 have progressed to the clinical development phase. And the great news is that there are now 19 vaccines which have received some kind of emergency use authorization, and 8 of them have been granted WHO emergency use listing. And these are 3 vaccines from AstraZeneca by different producers. It's actually the same vaccines by different manufacturers, Janssen & Janssen, Moderna, Pfizer-BioNTech, Sinopharm, and Sinovac. So the COVAX facility expert group has identified a transparent method for allocating vaccines during phase 1 and phase 2 to support an allocation through the COVAX facility, and at the same time reducing COVID-19 incidence to protect public health and to minimize societal and economic impact. So once vaccines are shown to be safe and effective and are authorized for use under the WHO emergency use list or approved by stringent regulatory authorities, all countries should receive doses of those vaccines in proportion to their population size to immunize the highest priority groups. And the calculation was that 20% of population in all countries should receive the vaccination first to reduce morbidity and mortality, starting with frontline workers and health and social care settings. These are 3%, and these 3%, gradually every country around the world which is participating in the COVAX facility should be receiving the vaccines, and then the rest of the 17%, which are high-risk adults, elderly adults with comorbidities, and other locally relevant risk factors. So this is very important to make an impact with the rollout of vaccinations. And only then further priority groups will be furnished by the COVAX facility. Also, a 5% buffer has been set aside for humanitarian deployment based on immediate needs. So currently, how does it look? The production under the COVAX facility. So the COVAX facility has secured 13.6 billion doses globally. And as of 9th of June, the COVAX has shipped more than 80 million doses to nearly 130 participating economies. So over 190 governments are now involved in this COVAX facility. And the COVAX facility has actually pledged with donors about $6.3 billion here, and you can see the pledges signed in green are the signed donor agreements and where cash has already been provided. And just on 2nd of June, another at the One World Protect Summit, an additional 2.4 billion doses, US dollars have been raised to secure, in addition to the 1.3 billion doses, another 500 million doses, which allows the advanced market countries, commitment countries, to achieve about 30% coverage of their vaccine supply by early 2022. And that is really good news. I would just like to raise two issues in the slides here. And these are data from early May, and we will see later this year whether has been changing. The situation is certainly changing with the month by the month. This was as of 10th of May, and you could see that 95% of high-income countries and upper middle-income countries and 77% of lower middle-income countries and low-income countries had started to vaccinate in beginning of May. 77% of doses were administered in only 10 countries using 10 different vaccine platforms. And what we have seen early May is that high-income countries have 160 times higher number of vaccine doses administered per 100 people compared to low-income countries here on the right. So this is really the story that we are operating on the background of a very, very limited supply. And this is as a limited supply is further aggravated when emergencies occur in some parts of the world. Here you can see the AstraZeneca supply to COVAX as was originally planned in February, March this year. And instead of 70 million doses to 60 participants, less than half were delivered in March. And those AstraZeneca vaccines from SK Bio in Korea, 1/3 of those planned were delivered, in fact, by March because of the surge of cases and the need for the vaccines in India. And it had implications all around the world. Much less affected was the Pfizer supply for COVAX because the quantity was much less. So in summary, the COVAX facility is an unprecedented initiative and attempt to guarantee fair and equitable access of COVID-19 vaccines globally to every country around the world which is participating. Challenges remain because of limited supply. We have a delay in production and combined but with vaccine nationalism. That means when countries, high-income countries, sign deals with producers before the vaccine is actually approved and to secure their supply. And we have learned it the hard way that in this pandemic, the virus reaches actually every country where measures have not been implemented, and then from there reintroduces big surges. So no one is safe really unless everyone is safe. So there are three concrete steps which are being taken by COVAX. Is a massive call for dose sharing of vaccine doses by countries through the COVAX facility, and the US and European countries have just recently committed to donate a huge amount of doses through the COVAX facility to other countries. Then also the major efforts are being made to scale up manufacturing capacity of countries, and tech transfers have been ongoing and are under assessment by several companies and donors. The example is AstraZeneca producing with the Serum Institute of India and SK Bioscience in Seoul, Republic of Korea. And then last not least, we are really looking for full funding of ACT Accelerator. So to achieve its ambitious goal, just COVAX alone is seeking to raise at least $3.2 billion for this year. So I would like to thank my colleagues who have helped me prepare these slides or review these slides. Thank you very much for your attention.